A very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, Interim General Manager at WEIU. My guests today are Diana Stenger and Gloria Spear from the Coles County Health Department. Welcome.
Thank you.
I do appreciate you coming in. I know we joked off air there for a second that nothing's really going on, so you have plenty of time. But unbelievable busy time for the Coles County Health Department. And Diana, as the administrator, I'll let you start. Just your initial thoughts on the last, 5-6 months of going through COVID-19 pandemic and all of the work that you folks have to do over there.
All right. Thank you, Jeff. So this is Diana Stenger, and I am the administrator at the Health Department here at Coles County. We have been following the Illinois Department of Public Health guidelines, which follows the CDC guidelines. Since our first case, the first part of April, we have been doing the contact tracing and isolation. Obviously, with the press releases, everyone knows that we have ramped up and our numbers are growing by the day. We are over 600 cases now in Coles County. Currently, we have 5 hospitalized, 20 of deceased, which is very sad to report. And then, so daily we get in our positive cases, we contact them, we get anybody that they have been in close contact with, and I can go into more detail if you want, but the health department has pretty much just been running operations 7 days a week since the mid-March, and that's where we're at.
Yeah, and we'll get into some of those details. When you in the last week since we had scheduled you, the Mattoon and Charleston schools have followed your guidelines, or at least that's what they're saying, and they're going online too for learning for at least the first quarter. Do you believe that's the right choice here in Coles County?
So we have worked closely with the superintendents of all schools and the regional superintendent. We have been since probably April looking at their plans. Our guideline is to look at their plans, give them suggestions of what's safe. What we have told them is we don't have a crystal ball. We cannot, predict the future.
Yep.
But we are here to support them in contact tracing, isolation, and giving them environmental health directions if they do have a case. And Mattoon and Charleston have both opted to go remote, and that was their decision. So, like I said, the health department is here not to shut anyone down, but to give guidance as far as schools, and we've been in multiple conversations with them.
Okay, thank you. Well, the contact tracing is the one I think is, I don't know if it's the right word is, but it's the one that comes to mind when people think about it, because take us through the process. So if somebody I know, let's say, person A has it or has been tested positive, how deep do you go to trace that person so other folks are safe or appear to be safe? Okay,
so how the contact goes and the isolation goes, someone goes and gets tested, and it doesn't matter where they are tested at. If they're a positive, their positive lab is reported in an electronic lab reporting system, which we receive then through Illinois Department of Public Health, our system.
Okay.
Once we have determined that we have someone that is residing in Coles County, and I know that's been a question.
Yeah.
Doesn't matter where they test, but if their address and they're living in Coles County, their permanent address right now, or even temporary address, is put as Coles County, we then monitor that case. So we get in touch with that person within 24 hours, and we ask them if they had symptoms. If they had symptoms, then we go back 48 hours from those symptoms, and we say, who have you since this date been in less than 6 feet longer than 15 minutes? And then if that case says I haven't had symptoms, then we go by the positive test date. We go 48 hours prior to that. and we say, who have you been less than 6 feet longer than 15 minutes? Those people then that are named, we then get in contact with them and we say, you are a contact to a positive case, and we cannot tell them who that positive case is because of HIPAA.
Yeah, I knew that
but
part.
the
Yep.
last contact to that case, then they start a 14-day isolation.
Okay. So no matter what, the other person is also in a 14-day isolation.
Yes, if they're named as a close contact, less than 6 feet, longer than 15 minutes, those contacts are all put in isolation.
Well, the other question would be, I know, and I think they've resolved most of this, but some of the people weren't getting their tests back for 3 or 4 or 5 days, and then it was positive. So is it everybody in that 3 to 4 or 5 day period that would have to be contact traced, for lack of a better way to say it?
So if a case tested, say, on August 1st,
Yeah.
and they didn't get their test results back till the 7th, and then we got the notification, we would still go back 48 hours from either their symptom onset or their test date, and then we would say, who have you been in contact with from that time to present? So
Okay.
it would be anyone they would have come in contact
So
with.
it would be a longer period of time then for them to think about who they talked to, right? Or in
Yes.
contact with. Interesting. I'm just trying to learn as much as we can and try to get the word out today. We're talking to Diana Stenger and Gloria Spear from the Coles County Health Department. Gloria, the other thing it seems to be is that there's just constantly new changes and rules being handed down by either the government or one of the people that you guys all report to. How do you kind of keep up with everything?
Well, this is Gloria, and we end up having to watch the same press conferences that the public do because we find out the same time everyone else does.
Oh, really?
And it's a constant struggle to listen to what the new changes are and try to find out the rules of it so that when the calls come in, and they do, we're prepared for them and we can give them a cohesive answer.
And that's what I want to talk about. When people call in, and I hate to say the word complain, but they complain about a salon or a restaurant or a business, what is the course of action that Coles County Health Department takes?
Prior to the masking situation, we would get complaints that a business was open or not doing something. Our first course was always to make a call because sometimes we found out that the business people were complaining on that was open actually changed their practices and they were essential businesses.
Okay.
So if somebody changed what they were doing and converted their machines to mask making, they become an essential business. And so we tried to figure out if they were truly essential, if they were not. If they were not, then we asked them, this is, I don't know, May, April, we asked them to close because they were not essential business. With the new masking rules and all that, we've had complaints since the governor said that about people who are not masking. And we have made calls. We have gone out to see if people were masking or not. It makes it very difficult when the complaint is about a customer who's not masked because by the time we get there, the customer is most likely gone. So right now, we are not finding because our public health board, our county board, our state's attorney all has to be on board with that. And that's not the intention. The intention is not to put a Band-Aid on it. It's to put a mask on it.
There you go. Good answer. Really good answer, actually. Obviously, in the last, I would say, 5 to 6 weeks, the ads and the talk out there is everybody has to wear a mask, and it's the rule. And I mean, are you a firm believer that wearing a mask is going to help bring the numbers down?
Yes.
Same with you, Diana?
Yes.
Okay. And so what are the rules right now? Let's say somebody's just coming into town. We have a lot of new students coming to Charleston. Every business you're required to wear a mask in. Is that the safe way to say it?
Yes. Think about it like a seatbelt, Jeff.
Okay.
Just because you have a seatbelt on does not mean you won't get in a car accident. It doesn't mean you won't get hurt in that car accident, but it does lessen the chances that you have a fatality in that car accident. So with a mask, it doesn't mean that you may not come into contact with somebody with COVID, but it does lessen your chances of getting sick.
Okay. Well, the other thing I know that's out there, and it's a touchy subject, and I know that HIPAA laws are in there, but what about the people that are, on Facebook or calling you or calling me or whatever and saying, I have the right to know that people I work with, not who they are, but where they work at, have COVID. Now, what are the actual rules? And try to explain to folks why you can't always release the information that everybody wants.
Well, this is Diana.
Okay.
Because of HIPAA, we are not going to release anyone's name. They wouldn't want that if they were the ones in the situation. So what we do is if there's a positive case, we get the information of where they've been or where they work, who they work with, and then we are able to reach out to that employer, and we encourage the positive case, to notify their employer. Even when we're talking to the employer, we can't say, Susie has tested positive, she works at. If it's a situation that it's not a medical facility that we can share HIPAA information, then we will ask her a list of employees, and we will say, you had a potential exposure on this day at this time.
Okay.
And we can't give any identifying information for people. So a lot of times when someone is deceased, people want to know the age or the sex. But in our community, if we give the age or the sex, it's too easy to look at an obituary and find out who it is. And that, again, that's enough information that you've got identifying factors, you can find the person, and that makes it a violation of HIPAA.
Okay. And I know in some of the bigger counties, like, they'll release that information. I think that's kind of why people down here think it should be that way too. And I understand exactly what you're saying there, but I think that information there, I think, is new, at least for me. So I think that's good to know. So, and that's what we had you on today, to try to get the information out to the folks. I know that when you saw the pandemic getting ready to start, you guys have emergency plans in place, but now that we're 6 months into it, how do the plans change, and do you continue the same path the longer this thing goes on?
We follow, once again, we're following Illinois Department of Public Health recommendations. We have a grant that we have had for years. It's called the Public Health Emergency Preparedness Grant. Your best laid plans, with this grant through Illinois Department of Public Health, we've done what we can do. The best laid plans always have to be very flexible. And with COVID, we have found that you have to be very fluid with this. Even data collection, what worked in March is not working today. With a novel virus, we have learned so much even in this short time, but we have a lot more to learn. What we knew worked possibly in March, April is not working, or the virus. We've learned more about the virus, so our plans have had to change.
Okay. Speaking of data, now, how many different places report to you, or do they report to the state, then you get a report? How does the process work? 'Cause I know you usually release the information sometime in the mid-afternoon, early evening. So can you take us through that process?
Yes, so that's the electronic lab reporting system. So we, once we get that in, we have to confirm addresses because, and that's why it's late in the day sometimes, is because we had 32 cases, and trying to get through all those 32 cases, there are bad addresses, there are bad phone numbers. We are trying to track these people down. We're doing everything in our part to try to reach out and find out where they reside. We call somebody and they're like, we haven't lived there for 3 years. I don't know how you got that address. Or same with phone numbers. People are changing phone numbers all the time, and it's very difficult to chase those down. So, we're trying to do our homework before we send out any press release so that we know exactly how many are in Coles County that day.
Okay, that's good, because I was going to ask you how good do you feel about that every day is 100%, and it looks like you're on that track of almost 100% accuracy in your data, because you're kind of double checking and triple checking it. That's good to know.
Yes.
Obviously, the numbers, they went down for a little bit overall, and when we talk about the state and Coles County, but then lately we've reached another, it seems like there's 17 or 18 every day in Coles County, then the state's been up. How worried are you two both about a potential increase in outbreak here this fall or not? What are your opinions or thoughts?
I think there will be a potential increase, and I think it's more than anything because of familiarity. So when if you're out in public or at a store, you're probably going to be more careful. You're going to stay away from people. But when you're around your friends or extended family, you're not going to be on guard like that. And that's a lot of what we're seeing with these cases. It's the familiarity. I was at a family function. I had a party with my friends. I had drinks with my friends at their house. And so in a situation like that, you've known them forever. There's no reason to be on guard, and we still have to be on guard.
Diana, do you want to add to that?
Sure. So historically, what we're seeing throughout Illinois and throughout the nation is, colleges are going back, schools are going back. We know that behaviors are not where we would like to see them in public health in certain age groups.
That's a very politically way to say it. I love the answer there.
So we are going to see increases. We are seeing them statewide. We're seeing them nationally. Until we can encourage people to change their behavior, and we know in the health field that the behavioral changes are the most difficult to make. I feel like we are going to have a higher increase in numbers just with the mere fact of the population that we're going to be serving here in Coles County.
Yeah, go ahead. Sorry.
And then, also with, fall coming, winter coming, we're going to have more people indoors, more people in, close contact in the same environment. And we're going to be seeing, our normal flu season. So I do think that our numbers are just going to continue to go up.
There's a lot of video placed this weekend on social media about college students who went back to college and are acting like college students have done for the past 60 years in this country. How concerning is that to you when you think that Eastern Illinois University getting ready? Really, they're opening up this week. Classes begin Monday, but you can tell right now in Charleston we're starting to get busier over here. So how concerned are you about EIU?
Well, I'm concerned with any school coming back or anyone coming in that is not following the wearing the mask, social distancing, and we're seeing that in Coles County, and is it related to Eastern? Some, but is it related to community spread? Absolutely. We are seeing a huge outbreak not even connected to Eastern, and it's so community widespread and county widespread. We're not able to put a finger on or point the one finger. What I say is, there are so many finger pointings, but remember, three fingers are pointing back at you. So why don't we 3 times make the effort to correct the solution or the problem to make the solution?
That's a good answer. When you think about this weekend, and I just went out a couple of times just to drive around and not go in anywhere, but just to kind of look at, there's people everywhere in Coles County. I know it's in August, it was a beautiful weekend and everything, but I mean, how do you curtail people from being out and going to restaurants and going to flea markets or whatever they're going to? How do you curtail that? Or is it possible?
I don't know that it's we're in phase 4. So, I think that we have to follow the executive order for phase 4 that allows groups to be out. What we have to try to get out there is one message of wearing a mask, keeping your distance. If you're sick, stay home. I think that that's the message that we have to continue, and we have to get on board with one message. We have been in conversation with the mayors of the communities, and we're hoping, and Dr. Glassman at EIU, and we're hoping to get out one message for the county. We've also been in conversation with the county health or the county board chair. So our hope is that, we can start getting out one message to wear a mask and social distance, wash your hands, stay home when you're sick.
I know over the weekend, Eastern Illinois University put up a bunch of signs. They had a bunch up, but now there's tons more as students are starting to come in about things to do, about entry points and exit points, and staying on the right side of the hallway and stuff. It's amazing. Over the weekend, this university transformed itself. So I thought that was good news. But I want to also ask you a question. I mean, we've come a long way in terms of knowing about this virus since it all kind of started in earlier this year. What is some good news right now? Is there good news out there to report about the virus and how it's being treated? Everybody kind of I don't want to stay only negative. Is there good news out there?
Well, I think the longer we go, the good news is that we're learning some symptomatic treatments. There is antivirals that we're giving the very sick, in the hospital, the plasma. Those things are happening, and I think we're learning as we go how to treat the symptoms more. I think the good news is the vaccine is in trial right now. So, I think there are good things happening behind the scenes that people maybe don't know about. The good news is there are people out here that are trying to do the right thing, and I commend Coles County residents for all that they're doing, because we hammer all the negatives, like you said, and there are people out here doing the right thing, and I totally appreciate that.
A couple of other things I want to talk about is this weekend something came out about a new saliva test from Yale that was immediate or something. I hate to put you on the spot. Did you hear anything about that?
This is Gloria. That
Okay.
was, I think, 24 hours.
Okay.
But it's less invasive. And with Yale's, what I've read is that they tested it alongside with the nasal swabs, and they were very, very similar.
Okay.
And I do know, U of I has been in the news as well. They do have this saliva test that IDPH now recognizes, and they are, I think they're pushing that out to more than just the U of I.
Okay. All right. I'm glad you both know about that, because I was just trying to get the information this weekend. And people were talking about it, but without any details. Now let's go back to the early symptoms. So, and I think that's the best time to catch it is somebody thinks they're starting to get sick. What are some of the early symptoms of COVID that people need to be on the alert for and immediately need to get attention for?
So what we have really seen a lot lately with the people that we're interviewing that are positive, they're saying, "Oh, it just is my seasonal allergy. I just thought it was my seasonal allergy." So some of the symptoms that we're seeing a lot of is I just kind of had a scratchy throat, a tickle in my throat, a little bit of drainage. I had some congestion. I've had a much worse strep throat before, or a cold before. But those are the signs of stay home and maybe go get tested or talk with your provider. People are having chills, night sweats, but they're not running fevers, or they may only run a 99. Some people run sub-low temperatures. And then the younger, 20, 29-year-olds, they're not really experiencing as much of the respiratory as they are the more of the congestion, the sore throat, the sneezing. Some of them are having vomiting, diarrhea, abdominal cramps. And one of the main things that we ask is, have you lost taste and smell, your ability to taste and smell? And that seems to be another sign.
Okay. Well, those are all good, so I get that out. Do you think there's an end game or an end time to this virus, or if you had to guess? I know nobody likes to guess, but are we looking at the end of the year, mid next year? I mean, what are your thoughts?
Well, personally, I think that, if we get a virus or a vaccine toward the end of the year, first of the year, I'm hoping that we can see maybe a slowing, but I think we just have to reevaluate, as we go. I'm hoping by next March we can see, that we have really made strides. But I think it all depends on the vaccine and, whether or not the virus mutates. I mean, we don't know what this virus can do or will do.
Gloria?
Yeah, I don't know when we're going to see an end to this. I think that a lot of what we have to go back to normal will require that vaccine. But that means people are also going to have to take the vaccine to get it, to trust the science enough.
Yeah, and a lot of people don't like to take vaccines early when they come out. They like to wait to see what the side effects are. So that's going to be another issue down the road, I guess. We'll push that one forward just a little bit.
Right. And I also, this is Diana again, I really don't know that we're going to go back to what we normally knew if you look at the 1918 pandemic, I think it was a couple of years before they really, went back. Are we going to be in this stage forever? No. And that's what I try to tell everybody. Please do your part. Please try to wear your mask and try to have some comfort in that. I feel that we're not going to be in this stage forever. There will be a light at the end of the tunnel. And we just have to, many times people have said it's a marathon.
There you go. It's a couple of minutes left with Diane Stenger and Gloria Spear from the Coles County Health Department today. I guess any other things that I have not asked you that you think is important for the public to know here in the last minute or so?
I think a lot of people feel that don't want to wear the mask, feel it is their right not to wear the mask. And I would say, look at the big picture. I wear a mask because I want choices. I want our local businesses to be able to stay open, the small businesses. If we don't bring our numbers down, we're back in the blue, and that's great. But if we're not mindful with our actions, everything will get closed down again, not because Coles County Health Department wants to close it, but because that will be the initiative from the state. So I wear a mask because I want choices, and I want our local businesses to be able to survive, and not only survive, but to thrive.
Makes sense. Diana, anything to add to that?
I think just, asking people to be patient with us if they make a phone call or a message. We try to get back to everyone. Social media, I get frustrated with that because, we're trying our best, and it seems like we're never putting enough out there, but we are doing what we can do, and we have to go through and assess each case, and we have to determine so many things behind the scenes that, we are trying to be very transparent. So it's not that we're keeping anything from anyone.
Okay. What time? I was going to ask you what time today's will come out, but I don't want to put you on the spot. So I appreciate you ladies calling in so much today. We've been talking to Diana Stenger and Gloria Spear from the Coles County Health Department. Thank you so much for calling in, and hopefully some of our listeners and viewers got some great information from you today. Thank you.
Thanks
for having us.
Everybody have a great day. This is WEIU.